Right. Hello, everyone. My name is Sadia Beg, and I am the Programs Coordinator at the Ontario branch. Welcome to today's webinar on family planning, tools, success stories, and coping strategies.
Before beginning our session today, we'd like to take a moment to share some truths and reflect on the landscape of work and play. We have an important responsibility to acknowledge the grounds on which we're privileged to work. Kidney Foundation Canada recognizes that our work of our branches, and our community chapters takes place on traditional Indigenous territories. We're grateful to be able to work, live, and play in these territories and acknowledge the harsh realities endured by Indigenous peoples for generations. We're thankful to the First Nations, Métis, and people who care for these lands and who continue to contribute to the strength of these communities. In light of this history, we dedicate ourselves to forward in the spirit of partnership, collaboration, and reconciliation. We honor the land and its peoples and will continue to work to cultivate respectful relationships with Indigenous for our research, programs, and community services.
The Kidney Foundation of Canada would like to thank our sponsors for the 2024 webinar series, Essentra, Amgen, AstraZeneca, GSK, and Otsuka. Their ongoing support allows us to come together to have broader, bolder, and braver conversations. The information shared in today's webinar is current as of today, October 8th, 2024. The information shared in this webinar is not intended as medical advice and is general in nature and does not necessarily cover all circumstances. While we make every effort to be accurate, we recommend that you seek professional medical advice for your individual situation. And now it's my pleasure to introduce to you our moderator for today, Manuel Escato, sorry. Manuel is a 17-year-old kidney transplant recipient. He received a transplant from his mom in 2007 after nearly 2 years on dialysis. In February 2022, he and his wife welcomed their first child, and in February 2024, they welcomed their second. As a transplant recipient, he's developed a passion for kidney and organ donation, health education, and supporting other patients to become partners in their care. Welcome, Manuel.
Thanks so much, Sadia, for the introduction. Welcome, everybody, to today's webinar. Before I get started, just want to also respectfully acknowledge that I myself am situated in Edmonton, Alberta, Treaty 6 territory, traditional lands of First Nations and Métis people. Very happy to be participating in today's webinar. For those who may have missed it, I participated as a panelist back in June of this year, sharing my experience with family planning and providing my perspective as my wife and I went through this journey of trying to conceive kids post transplant. And I'm super happy. So thank you, Sadia, and the Ontario branch for inviting me to participate today. Happy to bring this full circle, but not about me. So let's welcome our first speaker. Very excited to start the conversation. And I'd like to get started by introducing Dr. Sandra Dumansky. Dr. Dumansky is a nephrologist and scientist at the University of Calgary. Her program of research looks into how to understand the complex relationships between reproductive health, cardiovascular health, and kidney disease, and is funded by the Kidney Foundation. Dr. Dumansky's clinical interests involve addressing reproductive health issues in individuals living with chronic kidney disease, and she sits on the Canadian Women's Health Alliance and is a central lead for Wear Red Canada, which celebrates annually to raise awareness of women's heart health. Pass it over to you, Dr. Dumansky.
Wonderful. Thank you so much, Manuel, for the beautiful introduction. And huge thank you to the Kidney Foundation for having me here to speak today. And thanks to everybody for joining me. I'm really honored to be part of this incredible panel, and I'm only a small portion of it, so I look forward to learning as well. Now, next slide, please. I'm very blessed to speak to many different audiences about many different topics, but this one is near and dear to my heart. So as the director of the Kidney REACH initiative, and REACH stands for Reproductive and Cardiovascular Health, I spend my days as a kidney doctor helping people plan their families and move towards starting a family. And on the flip side, as a scientist, I work hard on developing new knowledge that will hopefully lead to making family planning safer and easier for individuals living with chronic kidney disease. So we only have a very short time today together, so this is going to be a bit more of an overview, but hopefully we can get into a bit more hearing the patient's stories, as well as a little bit of Q&A. But throughout my talk, I want to remind you of two important features. The first is that this is my perspective as a kidney doctor practicing here at this time. This doesn't necessarily represent the views of every single nephrologist in the country, so that's important to remember. Secondly, I want to be very clear that because we live in Canada and healthcare systems are provincial, every nephrology program is slightly different. So it's possible that this will have a Calgary, Alberta flair, but definitely reach out to your own kidney teams to kind of hear about the resources in your area. Next slide, please. So before I begin, I'd like to acknowledge that I'm here in Calgary. So I live and work and play in the traditional and present day territories of the Blackfoot and the Treaty 7 people, which includes the Siksika, the Piikani, the Guna, the Tsuut'ina, and the Stoney Nakoda First Nations. I also recognize that Calgary is home to the Métis Nation of Alberta, District 5 and 6. Next slide, please. As Manuel alerted to, this is part 2 of in our series. So I just want to remind the audience that if you weren't able to tune in for part 1, which talked about options, lived experiences, and self-care strategies, it's available on the Kidney Foundation website. It's an excellent discussion on how to plan a journey towards pregnancy and towards starting a family. And it talks about things like how kidney disease impacts pregnancy, how pregnancy may impact kidney health, and when's the best time to start a family. But today we're actually looking at where that black dot. So now we know all the options available to us and some of the important features about self-care and planning. So let's start talking about how to plan this journey with confidence and support. Next slide, please. Here's the starting. I want to get us all on the same page because there's often some confusion about what is reproductive health. So I use the World Health Organization definition, which states that reproductive health is a state of complete physical, mental, and social well-being. And it's not merely the absence of disease in all matters relating to the reproductive system, as well as its function and processes. So as part of this, reproductive health does include family planning. And it's important to remember that this is not only a privilege, but a right. Individuals should have the opportunity to try to reproduce, and specifically the freedom to decide if, when, and how often to do so. So this is important because we need to keep this in mind as we move forward with our own journeys. Next slide, please. So what is the process of family planning when you live with chronic kidney disease? Now, this is a question I get asked every day in clinic, and it's an incredibly tricky question because it's different for everyone. Your needs on a family planning journey are going to depend on a number of factors, specifically where you are in your kidney health journey. Do you have early stage chronic kidney disease, advanced stage chronic kidney disease? Is your chronic kidney disease treated with dialysis? Is it treated with a kidney transplant? And it also depends on the type of kidney disease you have, because of course there are hundreds of diseases that impact kidney health. There's also other factors that come into play, such as do you have other chronic health conditions, such as high blood pressure, diabetes, autoimmune diseases, and others? What medications are you taking? How old are you? All these factors really culminate to determine your journey to planning a family. But what is consistent and what is important to know is that family planning journeys, especially when you're living with chronic kidney disease, can be really windy. This is not often a straight path. Often there's hills too. We see lots of ups and we see lots of downs. So when we kind of approach this in the clinic, we think about what tools is everybody going to need for their journey as individual as it is. And I believe that we all need 3 basic tools to get us started. It's kind of like when you move out of home for the first time and you have your own home, pretty much everybody's going to need that measuring tape, that screwdriver, and that hammer to successfully put the new home together. Next slide, please. So the first thing we're going to need is a team. This journey to planning a family is something that should not be undertaken alone. We all need a strong team to lead us on this journey. Next slide. Secondly, we all need a support system. And although your team may provide you with some support, it's key to have a support system that is separate from your team to support you through those hills, through those highs and lows. Next slide. Finally, a plan. Everyone's going to need a plan, and these plans are going to need to be individualized. No one's going to have the same plan, but putting a basic plan together is really important before you take those first steps. Next slide, please. So the first question is, who is on my team? And that's a really good question. Now, when I talk about this, I really love this picture because I think it's pretty accurate in what a family planning team should look like. So often your team looks like this, with each person bringing one or two unique pieces of the puzzle to put together. Now, I want you to pay particular attention to the green piece in the middle. This should be you. What's really important about assembling a strong team is that you should be in the center of this team, and everyone else should build their work around you and your specific needs. So who will the members of your team be? I've already said it a couple times. No one's going to be surprised to hear it again. It's different for everybody, but I'm going to run through a few kind of common team members that we see commonly in family planning teams in the CKD world. So the first would be your nephrologist or your kidney doctor. So this may be your own kidney doctor. Alternatively, there may be a different kidney doctor that has expertise in reproductive health, or your kidney doctor may work alongside, a specialized kidney doctor. Often the nephrologist or the kidney doctor is the quarterback of the team. So they take the advice and suggestions from all of the team members and put it into an overall care plan that's going to incorporate everything. And of course, it should go without saying, your nephrologist is also responsible for looking after the health of your kidneys as you move along through the stages of this journey. You may also have an obstetric internal medicine specialist, and this is a specialized physician that manages organs and diseases prior to, during, and following pregnancy. And they may or may not be looking after your kidney health, but they're often taking care of other chronic conditions like diabetes, hypertension, and working hard to prevent medical complications of pregnancy. Your team should also include, if possible, a primary care provider. And this is a term we use to kind of talk about the people that manage your health overall. So usually a family doctor, nurse practitioner, and they're really important in this team in terms of coordinating care for your kidneys and other diseases. And importantly, keeping track of the pregnancy, ensuring that they're tracking fetal growth, fetal development, and fetal health. Similarly, having a pharmacist as part of your team is really key. So most individuals living with chronic kidney disease will have at least one medication. Many people are probably laughing on this call and will have many more than one medication to manage. So a pharmacist is key to help you manage your medications around the time of planning for pregnancy, and beyond. Oftentimes we see obstetricians on the team. And sometimes these are called high-risk obstetricians, which essentially means that an obstetrician with experience in caring for individuals that live with conditions that increase their pregnancy risk, including CKD. And obstetricians are important team members to track pregnancy, track fetal growth and development, and to ensure a healthy delivery of a baby. And finally, another common team member is a fertility physician, a reproductive endocrinology and infertility specialist. And this is really important if you run into troubles becoming pregnant along the way, because they can coordinate fertility treatments or even fertility preservation. So your team may not look exactly like this. It may have more members or less members, but every team member is going to play an important role. And the biggest part, as you can imagine, is communication. Next slide, please. When I talk about teams, I really like to talk about red flags and green flags. Because at the end of the day, when you're moving down this journey that can be, hopefully is going to be very simple, but can be very complicated, it's important that you trust your team. And sometimes patients will tell me that there's a team member that, maybe doesn't have their best interest in heart or doesn't understand what they want or what they need at this time. So I always tell people that it's a red flag if you have a care provider or a team member that doesn't choose to engage in a family planning conversation. Simply tells you, no, we're not having this conversation. This is not for you. No, pregnancy is not in your future. That's a red flag for me. A green flag doesn't necessarily mean it's a team member or a provider that's giving you the green light, go forth, get pregnant, but certainly it's somebody that wishes to discuss this with you, to understand the risks and benefits specific to you and your specific needs. Or if they have less knowledge in this area, is open to providing referrals to specialized care teams. So it's okay to expect that you're going to have a strong team to support you. And it's important to look out for these red and green flags. Next slide. The second thing that I think is really important, speaking of support, is what will my support system look like? And anecdotally, this is probably what I received the most feedback on, is many people don't expect to come to Kidney Clinic and talk about a support system. But I can tell you a support system looks different for everyone, but absolutely everyone. And I don't think that's necessarily unique to individuals living with CKD, though it may be different. So even if your journey is shorter, less windy, less hilly, support is key. And your support system during your family planning stages can carry over to trying to conceive, pregnancy, to raising a family. And of course, we all know it takes a village. Now, I hear a lot of concerns about setting up a support system or being so quote unquote formal about setting up a support system. And I think this really depends on the level of privacy that a patient wishes to maintain, especially at the very beginning where you're just planning to start a family or you're trying to conceive. Many people don't like to share that with many people. So determining who to involve is a very, very personal decision, whether it's a partner, whether it's family or friends, psychologist, counselor, peer support. Peer support's a great resource, and you can do this in an open sense, or with the internet, you certainly can do this in an open sense as well. But what I always talk about is how to set up your support system. It doesn't matter to me who's in it, but I think it's important how you do it. And my is to be direct. So one of the things we always kind of do as humans is we assume that our loved ones will be there for us when and if the time comes. And oftentimes that's true. But fertility and infertility and pregnancy, these are often very complex and private and vulnerable places in life. And even though I can say, hey, my sister's going to support me in this journey, I just know it, she may not know that I'm going down this journey. So I think it's really important to be clear about this. So first, I would suggest a dedicated conversation. So if a person knows what you're going through, if they know what you're planning, they know to check in and they know what stage you're at. And if we don't, sometimes we go through a lot of hard times without our support people even being aware. Secondly, I think it's important to have a direct conversation. So explain to your support person what you're going to need from them now and what you anticipate that you'll need from them in the future. Because some of your support people, you're going to keep around for emotional support. Some of your support people may be there to help you more with mental support. And some people are going to bring to the table physical support. So maybe they're going to join you in appointments to be a second set of ears, bring you meals if you're going through fertility therapy, help you with transportation. But be direct about what you're going to need, and also develop a plan with each support person about how you can both reassess the needs as you move forward, because the journey can be very unpredictable, and having touch base moments to say, hey, this is what I need from you now, is really key to maintaining that exceptional level of support. And the third piece of advice around support is that I think everybody needs to be open to change. Even our favorite people in our life, sometimes they don't bring you what you need from them. So it's okay to let people go out of the support network, bring others in as your needs change and as your journey changes. But at the bottom of everything, it takes a lot of bravery to set up a support system like this, and to be active about setting it up. So do be kind to yourselves throughout this procedure. But we do know that having an active and exceptional support system will reduce your stress during this journey. It will improve your mental health. And there's also evidence to suggest that there's potential medical benefits in terms of complications that arise during this journey. Next slide, please. So bottom line, I've seen a lot of family planning journeys and a lot of family development, and I have not to date seen one without any valleys or any downtimes. So roadblocks can and will happen. And of course, you're never going to know what's going to happen in your journey, but it's often important to prepare yourself for the what ifs. For some people, this may mean sitting down with their partner to say, hey, these are my expectations. These are my worst fears. If this is what goes wrong, this is what I think I'm going to need. Some people have kind of partner care plans that they develop. Other people planning for the valleys may be as simple as looping in their boss as a potential support person. Maybe not to provide that emotional or mental support, but to provide some physical support to say, hey, I'm undertaking this journey. I have absolutely no idea what lies ahead, but I do anticipate that some challenges are going to arise that will require me to step away from work at a moment's notice. And coming up with a plan so they don't have to do that last minute is really helpful for some people. So planning for the best and preparing for challenges is a really important part of starting this journey. So the big question is, how do I develop a plan? So now you have a great team, you've developed a support system, it's time to plan. And this is often the most fun, but the most hardest part of assembling your toolkit for sure. So a lot of people come to clinic when it's time to develop a plan feeling very overwhelmed, like they can't manage all of these moving pieces. And that's very fair because there's a lot of things to think about. But what I would say is this is why you have a team. Lean on your team. If your team isn't, providing all of your needs, expand your team. You aren't in it alone, and it really takes a village to develop a family, especially when you're living with chronic kidney disease. This is important to do prior to starting your journey. The plan should really include all the elements you foresee happening, shaped to the specific needs of yourself plus your partner or family. Now, not surprisingly, no one has the same plan. However, there are a few common elements that's important to start discussing with your care team. So we're going to discuss them. Next, please. Timing is a key part of the plan. I won't reiterate this because Dr. Cunningham in part 1 did an excellent job of talking about the when of family planning when you're living with chronic kidney disease. And we often use a red light, yellow light, green light approach, which depends on things like kidney function, the amount of protein you're peeing out, your blood pressure. But also this red light, green light, yellow light is directed by your category of kidney disease. Is it early or late stage kidney disease? Is it treated with kidney replacement therapy like dialysis or a transplant? And it also is dependent on the specific treatments. What's really, really important to know is that this has to depend on you above and beyond all of those kidney elements, because it's possible that, given certain diseases or certain circumstances, you may never make it to a green light or a time where it's kind of the quote unquote perfect time to start trying for pregnancy. And that's okay. It's okay to proceed in a yellow or red light situation. However, you have to proceed with a bigger team and a bigger plan at this point. So it's important to start these conversations about timing very early. And I have a number of patients in my clinic that kind of come and they're like, oh, doc, I think I'm wasting your time. I'm not going to be ready to even think about this for 2 or 3 years. And honestly, I tell them it's never too early because we can do things now and start talking and planning now to set them up for success in the future. Next slide, please. Another key part of the plan is modification of treatments. And this is probably a textbook in and of itself in terms of some of the treatment changes that we may need to make. But in a nutshell, sometimes you'll need to change medications because some of these medications are not compatible with pregnancy. You may need to add new medications that will help with fertility planning and pregnancy. Sometimes we need to change other kidney treatments such as dialysis. If you have a living donor and you're very close to receiving a kidney transplant in a bit of time, it may be prudent to wait until after transplantation. If you're on peritoneal dialysis, it may be prudent to switch to hemodialysis. If you're on hemodialysis, it may be prudent to start doing a lot more dialysis to help with fertility and pregnancy planning and pregnancy success. So although these are very, very individualized, there's certainly a number of additions, subtractions that we make to the kidney treatment plan in anticipation. Next slide, please. But the most critical part of every plan is flexibility. So your needs are going to change as a patient with respect to your kidneys. Your needs may change in terms of what you want from a family or what you want out of this journey. And as time goes on, yourself and your entire team may have to adapt to evolve. So never be afraid to ask those what ifs because it's important to make contingency plans. Next slide, please. And on that note, not every journey is straightforward. The straightforward ones are fun and they're great. And sometimes we feel like we do a lot of planning and it was just so easy, but those are rare. Most journeys have a few twists and turns in them. And we also know that individuals living with chronic kidney disease, male and female alike, of all gender identities, are probably at higher risk of infertility compared to those that are perfectly healthy. So we really do need to think ahead. And sometimes we hear this in clinic. What if I have this amazing team and I've built this amazing support network and I have an excellent plan and I'm following it to a T, but I'm still not getting pregnant? What now? Next slide, please. Thank you. And at the end of the day, it's important to remember that there are so many ways to build a family. And this isn't always easy to hear. So it takes the bravery to manage this statement as well. But for many individuals living with chronic kidney disease, your journey towards building a family may include fertility treatments or may include creating non-biologic families. So the question is, what options are available to me? Are they safe and will they work? And these are great questions, and they're questions that we don't have solid answers for. So we're in the very early stages about understanding fertility treatment and how that relates to chronic kidney disease. So overall, fertility treatments are very safe. But is the safety profile the same in individuals living with chronic kidney disease or similar? We don't yet have a full understanding. Or is the efficacy or chances of success the same in individuals living with kidney disease? Honestly, we don't know the answer to that. But what we do know is that all types of fertility treatments have been used in individuals living with chronic kidney disease and have been successful. So if you get to a point where you need to talk about alternative means of starting a family, it's important to talk about the efficacy and the safety within the context of your individual and personal health history with people that have the experience, with reproductive endocrinology and infertility specialists, perhaps with nephrologists or nephrologists with advanced expertise in reproductive health. So I'm going to do a very brief overview of the types of fertility treatment because many people hear a lot of words thrown around. But essentially, there's 3 major fertility treatments that are offered in Canada at this time. The first is the use of fertility medications. And fertility medications are really important to potentially induce ovulation or to make the egg more accessible to sperm, to increase chances of fertilization, or to improve the health of sperm to increase chances of fertilization. The second overall category would be intrauterine insemination, in which semen is injected into the uterine cavity to increase the chances of fertilization. And the third type is in vitro fertilization that we hear a lot about, in which hormones are administered to ensure that multiple oocytes are developed during a cycle. And these oocytes are actually retrieved from the body, fertilized outside of the body, encouraged to develop into embryos. And then those little embryos are placed back inside the uterus in an attempt to develop a pregnancy. Now, outside of fertility treatments, there's also lots of options that, fertility treatment isn't for everybody, so maybe a bit more accessible. This may include things like donor egg or donor sperm, may include things like surrogacy, gestational surrogacy, adoption, fostering. And these are very difficult conversations to hear, but at the end of the day, I can tell you that very beautiful, very happy families have been created in our clinics in all sorts of ways, and success is measured in a lot of different ways. Next slide, please. So at the end of the day, your family planning journey is going to be unique, whether you're just starting it, thinking about starting it, it's in your future, or whether you're partway through it, it's going to be unique. But it's never too early to start assembling your team, assembling your support system, and making sure you have a dedicated and detailed plan. One of the big questions that kind of comes no matter at what stage you're at is where you can get more information. And unfortunately for patients, for physicians, for all team members, there's very limited information out there and it's difficult to access. But one of the most incredible resources is peer support. And just a little plug for the Kidney Foundation. They've just announced a new group, the Reproductive Care and Chronic Kidney Disease Kidney Connect Peer Support Group. This is a virtual group that's free to join. And you can meet other people talking about their reproductive health or perhaps on their own family planning journey, gain some support with peers also living with kidney disease, and also learn more from experts. So hopefully, the Kidney Foundation team can put up a flyer at the end of this to share more information. So with that, I'd like to say thank you. I appreciate the time you took to listen today, and I'm very much looking forward to hearing the stories of our other panelists.
Thank you, Dr. Dumansky, for that fantastic overview. One of the things that you said right off the beginning really got to me, and it was when you gave the overview of the reproductive health. And I think this is what you said, but you said it's a right for individuals to decide if, when, and how to start the journey. I think that's really like a conversation that we have to have. And you did a great overview, recognizing that everybody's journey in general is different, but certainly once we get talking to patients that have chronic kidney disease, transplantation, all the different sorts of nuances that go, the medications that we are all on, and really just talking to, your care providers, talking to your team. Like I really appreciate that you gave that fantastic overview. I will also give a plug out for that reproductive health care team, that the peer support that you talked about. As you were talking, I found myself nodding, saying, yeah, like this is exactly what my wife and I went through. And in particular with the peer support, we were more on the private side of things, where we kept things to ourselves. We were our own team. And it was only after that we started talking to folks that we realized like the benefit that we gained in sharing our experience with others, and then recognizing that others, not necessarily those who have kidney disease or are involved in transplantation, but how many other people go through it, and just the value of you sharing your own lived experience with others has done wonders for ourselves and for the friends that we've been able to speak to. So thank you. We'll dig a little bit more into those topics in the fireside chat. But I'm very happy to introduce our second panelist. I see that Wendy has turned on her camera, so I am gonna very gladly introduce Wendy here. So Wendy was first diagnosed with lupus in 2009 when she was 26 years old. As a young adult, learning that she had lupus was quite challenging. She had many concerns about her future, especially around whether she could continue working, traveling, and starting a family. Not just a month after her lupus diagnosis, Wendy was diagnosed with chronic kidney disease. Not knowing anything about CKD, her first thoughts were, am I going to die? With the support of her family, doctors, and peer support programs at the Kidney Foundation, Wendy not only adapted to life on peritoneal dialysis, but has also thrived. In 2018, she received a life-saving kidney transplant from a deceased donor. Her new kidney has been going strong as ever. Love to hear that. And to her joy, she's been able to naturally conceive two beautiful daughters, her first in 2021 and her second in 2023. Wendy, I pass it to you.
Thank you, Manuel. Hello, everybody. Nice to be here, and thank you guys for having me. So like he said, my name is Wendy Nar. I was diagnosed with lupus nephritis back in 2009 when I was 26. A month later, I found out that I also had kidney disease. I knew nothing about any of these things. So like he said, the first thought that I had was, am I going to die? So I got diagnosed and I got medicated. As a lot of you guys may know, I was put on prednisone. Prednisone is the worst drug, but the best drug. So I was on that for a few years. And then in 2014, I got sick with the flu. And then at that time, I had to go on PD dialysis. I was on PD dialysis for 4 years. And in between those 4 years, I had 2 hip replacements, one in 2016 and one in 2018 due to my lupus. So in 2018, I had my kidney transplant just 3 months after I had my last hip replacement. It's been going well so far. I met my husband in 2018, just a few months after I had my kidney transplant. And we, got to know each other. In 2020, just about a week before COVID and the city shut down, we got married at City Hall. And in 2021, we welcomed our first daughter. She's now 3, and her name is Malika. And then just last year in 2023, we welcomed our second daughter, and her name is Marley. So overcoming all these struggles and tribulations during my time with having these diseases, I've learned a lot. The Kidney Foundation has truly been a great help in mentoring myself and helping me getting to know who I am as a kidney patient and who I am in terms of becoming a mother, and also helping other patients in learning that they've have kidney disease as well. Right now I am part of a group where I facilitate with another facilitator, and we're doing the same thing that we're on right now, and helping other soon-to-be mothers who are diagnosed with kidney disease so that they can be on their journey in becoming mothers as well, and figure out their ins and outs of what they can do and their journey in becoming moms. So yeah, that's it. Thank you.
Thanks so much, Wendy, for providing that outline. I will say congrats on the transplant, and on Malika and Marley. As I was reading your introduction there, that am I going to die, like that just really struck a chord with me. It's something that I know we've all thought of, on the stages that we've been on, like regardless of the stage that you've been on with chronic kidney disease, kidney failure, transplant, and whenever I hear those, it really hits home, and it's I appreciate your vulnerability and sharing that, because it's not something that's really easy to share. Again, we'll dig into some of these pieces a little bit more in a fireside chat, but for now, we'll welcome our second panelist, Nada Khan. So Nada's kidney journey started when she was diagnosed with FSGS at the age of 19. With medication and yearly checkups with her nephrologist, she's been able to keep herself off dialysis. Nada got married in 2015, and a few months later, she was asked to start dialysis. A month later, Nada was pregnant and with her first child, a boy. Unfortunately, due to being born premature and other complications, he passed away 6 months after he was born. Under her watchful eye and many consultations later with her doctor, Nada conceived her second child in May of 2016. And she was asked to be on dialysis for 6 days a week for 6 hours a day until she gave birth to her daughter, Anya, 36 weeks gestational. Nada did not have an easy journey, but she says, I would do it all over again if I had to. Thank you, Nada, for joining. And I turn it to you to share your experience with us.
Hi, everyone. Thank you, Kidney Foundation, for asking me to be a panelist. I'm so honored to be a part of this group. I've been I heard Wendy's sort of story, and I started getting emotional, and I'm like, the last thing I need to do is get emotional on this call. And even what Dr. Demensky was saying about just the sort of support group and the support group that we need, and also just communication is just so important. And hindsight 2020, I wish I knew these things when I was 20 years old, when I was first diagnosed with FSGS. I was 19, sorry, at that time. And I think my journey has definitely not been easy. Just as a side note, by profession, I am a CPA. I work for an accounting firm in Midtown Toronto. I've been there throughout this journey. I didn't let it hold me back. I was like, that I got dialysis, and I'm gonna persevere through. But I think being diagnosed at such an early age was not easy. I think that at the age of 19, everyone's you're growing up. You're starting to everyone's into getting into relationships or getting into universities, and sort of going down those paths. But being diagnosed and then being on prednisone, which, as Wendy alluded to, is like the best drug and the worst drug. Having a moon face, it's not easy. It's not easy for your self-esteem. It's not easy to go through it. But I had to, and I was really young. Thankfully, as Manuel mentioned, I was able to stay off dialysis for a very long time until I got married in 2015, and shortly thereafter, I remember my doctor's like, your blood work is just not good enough, and you need to start dialysis immediately. And I remember vividly now because I think I've blocked off that part of my life. I remember just bawling and saying, I can't do this, right? And but again, you don't have a choice. You have to sort of move on, and you have to. If I learned anything about having a kidney disease, it's to be resilient, right? You have to be able to just keep on swimming, as they say in Dory says, I believe, in Finding Nemo. You just got to keep swimming, and I think it's shown me to be resilient in whatever situation I've been put into. Um, Going further onto my journey, I was on dialysis for 8 years. But even before I got into dialysis, I just wanted to take a little bit of a detour and tell you guys, like, my nephrologist, for whatever reason, now it doesn't make any sense to me. Like, I remember he was in Canada, and I remember him being so adamant that you won't be able to get pregnant. So make sure you tell your fiance you can't get pregnant. And I was like, I just sort of like, shoot him off sort of like in my head. I'm like, yeah, yeah, whatever, right? And I remember him specifically asking me, he's like, did you speak to your fiance about not getting pregnant? And I was like, okay, like I'll speak to him. And I clearly remember on a ride back from Niagara Falls, I was driving back with him and I was bawling in the car and he's like, well, what happened? And I said, I can't bear a child. And he's like, that's okay. And I told him, I'm like, you can leave me if you want, but because I can't bear children. And he's like, no, it's okay. Like, I'm marrying you for you. It doesn't, we'll deal with that, with that roadblock, if that is one, when it comes to it. In hindsight, I wish I did more research. I wish I knew about the Kidney Foundation. I wish I knew people like Dr. Demensky, and my doctor, Dr. Holdanowicz, I was under the care of back then, because there's a whole new world that I didn't even know existed. And when I remember Sadia called me last week and she says, would you like to be a panelist in this thing? I jumped at the opportunity because I feel the word isn't out enough. I'm sure you guys have been trying for the past few years, but I myself didn't know, and I want to be a part of, keep putting the word out there that having a kidney problem for as a woman or even as a male is not the end of the world. There is a light at the end of the tunnel. We just need the tools and the resources to be able to do it, and that's exactly what this webinar that all of you have joined is sort of alluding to. Um, but I've also felt very alone. I never wanted to tell anyone that I had a kidney problem. I hid it from everyone until I got my transplant last year. I don't think 50 or 75% of the people that I knew even knew I had a kidney problem. That's how private I kept it. And I think Dr. Deminsky also alluded to that, right? Like sometimes it's not an easy thing to share, and definitely sharing reproductive health questions or concerns with others is not easy. But I think, communication is important. But sort of going back to my journey, I conceived my going back to what the doctor said, I can't get pregnant. I got married. I skipped my period, and I remember my dialysis nurse asking me, "When was your last period?" And I'm like, "Oh, I haven't had it in 10 days." And she's like, "Are you pregnant?" And I said, "No." And she's like, "Well, why not?" And I'm like, "Because my doctor told me I can't get pregnant." And she's like, "What do you mean you can't get pregnant?" And she's like, "You've missed your period. How do you know you're not pregnant?" And I said, "Well, that's what he told me. So I'm just going by that." And lo and behold, she did a test and I was pregnant. Um, Unfortunately, that pregnancy, as Manuel mentioned in my bio, due to complications, he was born, but he was born premature and he had a lung issue and he passed away at 5 months and 3 weeks. Very a very hard part of my life, which is very difficult to talk to. But I think I'm here to talk more about my second pregnancy and the family planning that was sort of involved in that. I remember my doctor, Dr. Holdanowicz, sort of like sitting down with her, and I said, She saw me suffer through what I did with my first pregnancy and losing my child, and she says, "Are you sure you want to do this?" And I said, "I am absolutely sure." And she said right off the bat, she's like, "There's going to be a time commitment and you need to be ready for that." She said, she said right off the bat, she told me, she's like, "It's not going to be easy. Um, you know, there is going to be a time commitment, 6 hours a day, 6 days a week. You have to be ready to do that." and I agreed to it, and so did my husband. I remember she said, we need to meet with you. We need to get sort of, make sure your medications, your blood levels are fine. Like she sort of did her checklist of what needed to be done, and then I guess someone was looking out for me up there, but I got pregnant a month after I had this discussion with her, and you bet that she made sure that I was on dialysis 6 days a week, 6 hours a day. I was also working full time. I think I never let dialysis hold me back. I even traveled across the world doing dialysis, whether it be in the US, whether it be across Canada. I even went to Pakistan and did my dialysis there. And again, resilience, and communication with my support system, my doctors, letting them know I'm doing this. I think it's very, very important. I also just wanted to just share, as I finish up my story and pass it back to Manuel. I just wanted to sort of say, let everyone know you are not alone. Ask the questions that need to be asked. It is very important to talk to your doctors, to talk to your support system, your significant other, and just just don't feel alone. There is someone out there that is going through the exact same thing. You just don't know it. And I think the Kidney Foundation is really making an effort to help open those lines of communication so that everyone is aware and that the knowledge is there. And I think with that, Manuel, I'll hand it back to you, and we'll move on.
Excellent. Thanks, Nada, for sharing your experience. Really resonates, your message there that, we have kidney disease, but it's not the end of the world, and showcasing kind of, you traveled the world, you did things. And I think that's a really important message. And then again, it comes back to the value of peer support, right? Trying to understand and learn what tools are out there from our medical team, of course, but also from patients who've lived through there, and trying to understand what their journey's been like, and how, we can help each other find different tools that work for us. Thank you for sharing that. I'll invite Dr. Dubansky and Wendy to turn on their cameras now as we go into our fire chat. But one of the things that really, that was outlined throughout all three, but really resonated is, this idea of, you have kidney disease, you can't get pregnant. You mentioned that your doctor said that. Nada, I was at a conference last month and I heard a patient say the same thing, that it was, like it was an absolute, you have kidney disease, you cannot get pregnant. And sometimes patients take that as that's what it is. And that's kind of what the idea that they take with. So kind of with that, preamble, maybe I'll pass this first off to Dr. Dumansky. What are some of the most common misconceptions that you encounter regarding family planning and kidney disease?
Oh, that's such a great question, because I think you kind of nailed it on the head. I think when we talk about the most common misconceptions, this often is about ability to become pregnant or safety of pregnancy. So it wasn't actually that long ago. I can look back in the, my nephrology training, the medical system training that we get, and we were taught for decades upon decades that people living with kidney disease can't get pregnant. And I want to clarify, especially females living with kidney disease. We were also told that males living with kidney disease have a lower chance of success of becoming pregnant as well. But this is something that was very commonly taught. And unfortunately, it was taught without a full understanding of the science behind it. So this has ensured that the nephrology world has evolved in a way that it's not uncommon for nephrologists to truly believe that. And they believe it so thoroughly that we're not doing important things like talking about contraception with our patients, because we believe it's a non-issue, right? So from a practitioner standpoint, I think that's a really big one. I believe we're getting better. The world is changing. We're evolving. We're learning more. There's lots of specialized reproductive health clinics in Canada now, which is wonderful. But it's going to take a lot more education to get all of our healthcare providers on board to say, not only can our patients become pregnant, but they do. And it's a little bit different. So we're going to we need to manage this maybe a little bit differently. I also hear from practitioners talking about pregnancy, so medical team members saying, well, even if they can get pregnant, they shouldn't because they don't have good outcomes. There's maternal risks, there's fetal risks. Maybe this is something we should advise against. And in the 1990s, early 2000s, we have one of our very limited studies, but it suggested that over 3/4 of nephrologists were advising against pregnancy for individuals living with advanced stage chronic kidney disease. And I'm sure there's many people on the call not surprised to hear this. So yes, absolutely, there are inherent risks becoming pregnant when you're also living with chronic kidney disease. Absolutely, but some of these risks can be managed, and it doesn't necessarily mean that all pregnancies are going to result in negative outcomes or higher risks than average. So I think we really need to work with our healthcare providers to talk about the wide range that we see in pregnancy and fertility in CKD, and also provide education about how we can best support our patients. Because at the end of the day, I have to believe that's what everyone wants to do. They just need the knowledge to do so. When it comes to the flip side of the coin, so that's kind of the provider side, the patient side is a little bit similar. So I really resonated listening to Nada and Wendy speak because both of them express this inherent fear. Fear of kidney disease or fear of pregnancy. And holy moly, the both of them together can be really scary. And I see this a lot. So patients believe, hey, I can't get pregnant. Or if I do, it's going to be a disaster. My health is at risk. I will never have a healthy baby. I may need to terminate my pregnancy. We hear all sorts of things. And I think that really speaks to the fact that many pregnancies kind of come out of left field, especially when we're not talking about family planning, not talking about contraception, and telling our patients, perhaps, like in Nada's case, that you can't get pregnant. So I think we need to do a lot of work to start having these conversations early. Absolutely, we see amazing outcomes in our clinic. I think I have the best job in the world helping people family plan when they're living with chronic kidney disease, because there's lots of beautiful, beautiful stories. And I think we really need to communicate that to the wider population because there's a lot of fear and misconceptions about what it looks like. So thank you very much.
Thank you for that very fulsome response. I agree that, these conversations are important. Timing sometimes can be an issue, and, recognizing many of the themes that you talked about, but, time can be an issue. Kind of the vulnerability of, can I have children? I think about it from my perspective, like I'm pulling this question from my perspective is, when the idea of having children came to me, I was direct with my nephrologist. I said, hey, this is what I'm thinking, and we had that conversation. I was okay with that. And some folks might not be okay having that conversation as part of the, either pre or post-transplant pathway. Is there a time that, that your healthcare team will bring this up, or is it more left to patients to bring this sort of conversation up? I'm curious how that works.
Wow, I think that's an amazing question, and I have a suboptimal answer, because what we hear from our patients when we do surveys and when we talk to people, we hear that they had to bring it up with their care providers. And kidney disease is really, really hard. Living with CKD is so hard already. It kind of breaks my heart a little that this is also put on patients. Like, not only is it your job to manage all these complicated health conditions, but now you have to bring this up with your care providers. But I think in Canada, that's the reality, that most people believe they need to bring it up with their care team in order to get the attention that they need. And like you said, a lot of people are too nervous to do that, or don't know that their kidney care team is the right person to bring that up to. How I think it should be is the opposite, and how I personally try to run my practice is the opposite. I think every stage of kidney disease is an important time to talk about family planning and reproductive health, whether that be pregnancy, whether that be menopause, menstruation, hormone therapy, contraception, sexual health. I think we need to normalize recognizing that CKD affects all of these and talking about them all the time. Now, does that mean I bring this up in every clinic appointment with every patient? Absolutely not. But I make an active effort to try to bring this up with every patient at multiple times in their journey to normalize the conversation, and also to let them know and signal to them that it's okay to come back to me if you have questions. Because I think, as much as I love my gynecology and family medicine colleagues, but I'm not a gynecologist. I'm not a family physician. There is lots I don't know, but I want to be able to make the path easier for people to address these concerns. So I think, we have a lot of work to do as a nephrology community in terms of how we bring this up, when we bring this up, and who brings this up, because it shouldn't just be the kidney care doctor as well. We need to have our nurses and pharmacists involved, our social workers. This is an important part of health, an important part of quality of life. So I think, ideally, we would bring this up with our patients and signal that it's okay to have this conversation. But in reality, I suspect this isn't the case for most people living with kidney disease in Canada.
Thanks for that response, and I think really well said though. Just really driving home the point of just the different, like your puzzle earlier about all the different elements and all the different team members that are really integral into this phase of family planning. Maybe I'll switch to Nada and Wendy. I'm wondering if you would be okay with discussing some of the biggest challenges you face in navigating family planning with kidney disease, and were there certain tools, were there certain resources that helped you overcome these challenges? Maybe I'll point to Wendy first, and we can go to Nada.
There was no tools. I did speak to my nephrologist at the time that I was getting older. And that I wanted to start planning a family, just so that I didn't want to wait till the last minute and then rush into anything. And so they did refer me to Dr. Michelle Ladinowicz. And I did go and see her a long while ago before I had my transplant. She explained everything to me. I walked away with more knowledge than I knew before, but I was kind of saddened at the fact that they wanted me to wait a year after my transplant. But then in the end, I actually ended up waiting almost 2 years after my transplant to begin. So, it was a bummer to me that I couldn't start when I wanted to because I was on PD, but then I was advised that I should go on hemodialysis. And I knew that wasn't a direction that I wanted to go in. But if I had to, I would have done that just to see if I was able to, conceive and whatnot. So, yeah.
Thanks for that, Nada.
Yeah, to unmute that. In terms of hurdles with family plan, I think just having that conversation, it's really, maybe it's just, I don't think it's just me, but I think just having that conversation in general is awkward, and you don't know when to have that. You don't know what the response is going to be. But another sort of hurdle is once you do have that conversation, sort of what the answer is, right? Like, so in my case, it was, you need to be on hemodialysis 6 hours a day, 6 days a week. That was a time investment. I had to be mentally prepared that I needed to invest that time. I think I spent more time with the nurses at dialysis than I did with my husband, because during that period, like, I was super close to them. So much so that I, never wanted to leave dialysis. And then my doctor's like, no, you need to get a transplant. You can't stay here forever. But I mean, what I'm trying to get at is the time investment was huge. The emotionally, mentally, there was a lot attached to it. Plus, you're pregnant. I mean, as it is, I think your hormones, I mean, I'm not a doctor by any means, but your hormones are all out of whack. I think Dr. Demansky would agree. And, to go through dialysis and that much, it's next level. So I think hurdle initially to have that conversation, because it's awkward, but then also what comes after. Okay, what is the result? What are we going to do about it? And how are we going to deal with it? So I think that's I hope that answers the question.
No, yeah, that's fantastic, and that really resonates with something that Dr. Demansky said earlier. I think he said, it's fun and overwhelming. Again, thinking of my journey with my wife, it is overwhelming. It's kind of similar situation where I talked to the nephrologist and he said, okay, how long you've been trying for, let's check in a year comes back. And then from there, it was kind of out of his hands. He referred me to a urologist. But the point I'm getting at is, it's overwhelming in the sense of the steps that you have to go through. But the fun aspect of planning is that you hope that there's, you're maybe a little bit closer to that resolution.
Yeah.
At least that's the way I took Dr. Dumansky when you said fun and overwhelming. It's overwhelming. It's not an easy challenge. There are so many emotions connected to this journey of family planning, and added layers, of course, when you're talking about chronic kidney disease, transplantation. But it is, you make the choice and you're going to do this, and you kind of take it step by step. That's an excellent segue to the next question, open to all you three. Can you talk about the role that mental health plays in family planning for kidney disease patients? For Wendy and Nada, maybe talk about some of the supports that you found useful, from the patient perspective. And for Dr. Dumansky, perhaps some of the supports that are available, in the clinics with your medical team that might support, mental health throughout this process. Whoever wants to go in first.
I think I'll just chime in. I think one of my biggest things is support system. It has to be, someone who you're close to. And I think I really wish I met you, Dr. Demensky, a long time ago. But it's just it's like who are you comfortable with? Because talking to just anyone, you're not gonna talk to someone off the street about this. It has to be someone close. It has to be someone that you're comfortable with. So if that is your and it's a very private part of our lives too, like internally. So even to share that sometimes with our spouse, even though they are our significant other, and we share all this stuff, having that conversation is not easy even with them, but it is important. And that's why I think one of the biggest things I've taken away is communication, whether that's open communication with your family, with your support system, be it your husband, your sister, your brother, your mother, whoever you're comfortable with, and most specifically your doctor. You should be comfortable enough to speak to your doctor about these things. And sometimes I would just, even if I wasn't comfortable with my doctor and I was closer to the nurse practitioner, I'd be like, oh, do you mind asking the doctor about this? Like, I'm just really nervous. She's like, why? She's like, you're so close to her. I'm like, I am, but I don't want to ask her this question, right? Just to know that the doctors are they're there for you, and they can only probe so much, right? They can't ask you to like open up the book and just tell them everything about your life. Like, they have to have a little bit of restraint, I guess. That's why they don't keep on asking us. So sometimes if you're not comfortable with them, maybe ask an associate. I mean, that's what I did and it worked for me. I'm not saying you shouldn't be able to talk to your doctor, but ask people. There's a team of people, right? I mean, I don't mean to keep on referring to what Dr. Demensky said, but really what she said in her presentation is correct. Like, there are the different pieces of puzzles. You can ask different people different things and get your answers. That's what I had to say about that.
Yeah, it really speaks to that the normalizing piece, right? Having this conversation, not at every clinic, but just as Dr. Dumansky said earlier, normalizing these conversations so folks can be, a little bit more comfortable in asking questions and sharing their experiences. Either Dr. Dumansky or Wendy, just, a little bit on the mental health piece and some things that, either patients have found useful that you've seen or what you found useful yourself.
I found useful in terms of speaking with people and just sort of having like someone to lean on. I usually don't speak to my family about it, only because the culture that I come from, stuff like that isn't really spoken about, and it's not like an open dialogue. So I found that speaking to my nurses and my doctors at the time was really helpful. I had great doctors and nurses back in the day. And of course, I have great doctors and nurses now. So I always found it helpful to speak to them and ask them questions. And they were always great in, getting back to me if there was something that I had asked and they weren't sure about. So, yeah.
Thanks for that. Wendy, really, really similar to my experience. coming from a Hispanic background where my siblings, had multiple kids and my wife's siblings had multiple kids. And then you have, now you're in your 30s and your parents are, hey, so when you can have kids, when you can have kids. And it's really hard
Yes.
to like really just speak about that, especially when you're going, through these added layers that nobody in your family, at least is publicly said, spoken about. So love your response. Dr. Demansky?
It's amazing. I love learning from Nada and Wendy on this because I can sit up here and tell you to build a social support network, but in reality, I don't live with kidney disease and I'm not on a family planning journey through kidney disease. So it's really neat to hear what you've leaned on and who has become important to you. And it kind of, I've heard some things about, oh, I leaned on this person for this, or, oh, my nurse practitioner helped me bridge the gap, even though I was very comfortable with my physician. And I love hearing this. You guys, it's really, really inspiring to listen to you talk. I think you guys nailed it. I mean, pregnancy is hard, fertility planning is hard, raising children is hard. Nothing is easy about all that. Kidney disease is hard. You put the two together and it's going to be massively difficult. So having that emotional support and that mental support, like I said, many patients come to our clinic and they're shocked. We spend so much time on this because they expected us to discuss medications or this or that. And honestly, changing medications doesn't take a lot of emotional or mental power, right? We have a little procedure, we have a checklist, but really what takes the time is setting people up for success. So absolutely, I agree wholeheartedly with what you've said about those emotional support needs and leaning on a variety of people. I would like to kind of talk a bit more about mental health a bit more specifically, because we do know that infertility, especially when one's trying to conceive, as well as pregnancy, has implications for mental health disorders or worsening of mental health conditions. So, even if you're perfectly healthy, you're likely to experience some symptoms of impaired mental health just because you're going through hard times, and that's okay. Now, one of the things I think is really important to mention in a conversation about mental health is you don't need to do it alone. And your social network or your support network may not be the right ones to support you. So sometimes when going through these really difficult moments or these really complex paths, you may need to reach out for more formal supports. And that's usually through the kidney social worker, perhaps a psychologist, maybe even psychiatry. Sometimes we need to medically manage these situations because mental health is absolutely impacted by reproductive health. And it's terrifying and it's great to have peer support, but sometimes you need more formal medical support in this realm too. So I really want to kind of drive that home to anybody kind of starting their journey or on their journey or thinking about it. And then just to kind of conclude, in response to Nada's point, talking about having a team and knowing that you could talk to your nurse practitioner who would reach out to another team member, I think I also have to recognize for many people on this call that I practice in a very privileged area. So I come from a tertiary care center, which means not only are there tons of nephrologists around me, but lots of us are specialized in reproductive health. We have a reproductive health clinic. I have team members of all sorts at my disposal, which I recognize may not be the case in many parts of Canada, right? Outside of that tertiary zone. So one of the things I recognize is that our patients are supported by a larger and easy to access team, which is a privilege. But many people are doing this in rural or remote areas where they may not even have a nephrologist, or the nephrologist may not have the option to hook them up with all sorts of these specialists with an interest in this area of medicine. So building your own team is really important. And I always remind some of my more rural and remote patients that you do have options. If you're not feeling supported by a particular team member, we all have the option for a second opinion. And that's something built into the Canadian healthcare system. And our healthcare providers, I certainly don't. They may not have all the answers, right? But we have a network of providers around Canada. And I laugh a lot because it's usually Saturday afternoons. My phone's just lighting up, and I promise my social life isn't that exciting. But it's lots of texts from colleagues around the country, or bouncing ideas off each other, or colleagues where they don't have reproductive health clinics for CKD, and they're just like, hey, how do I proceed with this, or what's normal, or what do I say? So as a physician, I often reach out for second opinions too. So it's really, really good to know that your team doesn't necessarily end at what you can see, as we're trying to help each other too, and we're gonna keep trying to build these networks for more successful care, no matter where you live in Canada.
Thank you, Dr. Dumansky, for outlining some of those added layers and added barriers that some patients that they do experience. The geography being one, language being another. Nada said made a statement earlier about I wish I would have done more research, and that really speaks a lot to also like the health literacy, language, ability to communicate. And an important piece that has to be recognized as well as we go through this pathway, whether it's family planning or in general, throughout the kidney or transplant journey, we are going to continue the conversation, but I know we have some folks online, so I just want to remind everybody to this is your time. Happy to open discussion to everybody. If you have any questions, if you haven't yet, please submit your questions to the presenters by typing them into the Q&A found in the Zoom toolbar at the bottom of the meeting window. Please avoid using the chat box to submit your questions. It helps us to monitor them more effectively when they are submitted to the question pane. So in the chat, there should be an option there where you can ask a question directly to the question pane. So give it a couple of minutes or a couple of moments to see if anybody has any questions, and then we can continue with the conversation. And let me have a quick scan at questions here coming my way. Maybe we'll get started with what would be some self-care tips after giving birth when on dialysis and having a transplant? Maybe I can, I don't know who feels most comfortable, maybe Dr. Dumansky, if you feel taking this question on, or of course, Wendy and Nada, feel free to chip in, but what would be some self-care tips after giving birth when on dialysis and having a transplant?
I don't really have any tips. I try to be very organized, so I got a lot of stuff ready before I went and had my kids. So I just tried to have a lot of family members around to help. So I had a C-section. So I don't know if a lot of you guys know about that, but C-section is very difficult to come out of. Usually it took me about a month before I bounced back up. So I got everything ready, had lots of family members around to help. So yeah, the most you could do is just organize yourself accordingly so that you can have other people sort of cater to you when you're at home. And yeah, that's about it.
Thank you.
I think from my perspective, I just like Wendy, I with my second pregnancy and my first, I had a C-section, but more so with my second pregnancy, my after pregnancy was actually, I think, didn't go as well as what I was going through during my pregnancy. I was not well after it, and I had a lot of water retention. I had water in my lungs. Like, so there was a lot of, I was not feeling well. And in terms of self-care tips, like, be aware of what is normal for you and getting in touch with your doctor. Um, you know, um, I had conversations with my doctor, like emailing or calling and checking in if I was, because she did give me a heads up that you may feel like this. I don't know, maybe it was because I was on hemodialysis. I don't know the reason why, but I had a few trips to the ER, and she would tell me you need to go into the ER or whatever. But just being mindful of what your normal health is, and if it isn't, you need to go seek further help. Like, don't endure pain unnecessarily. We have a healthcare system for a reason. That's one tip. I mean, be your own advocate. If you're not feeling well, like, go for it. And I think what Wendy said is being organized. Just like Wendy, I had family members that were looking at that were looking after my child when I was just not up to it, or when I was basically in the hospital again, taking care of stuff. So, those are some of the tips. I don't know if Dr. Demensky has more to add, but definitely be your advocate, I think is one of the bigger ones.
It's really
Thanks.
incredible. And I want to say I'm the only panelist that hasn't had a baby after being treated with dialysis or having a kidney transplant. So grain of salt with everything I have to say here. I'm not the expert. But it really resonates, and one of the reasons we set people up with a support network is so that they can carry it over. Because at the end of the day, and we talk about self-care in a few different ways, but at the end of the day, no matter how you bring a new baby into your life or a new child into your life, as a parent, it's going to be really easy to forget about yourself and focus on this new child. And unfortunately, fortunately, that's not an option when you're also living with kidney disease. So you have to find a way to section off pieces of your world that are dedicated to keeping yourself at the bare minimum, getting your basic needs met as an individual living with chronic kidney disease. And then also on top of that, you want to make sure you take moments for yourself that are not just simply devoted to maintaining your health, right? And I think that really means asking for help, not being afraid to seek help wherever you can get it. Individuals come back to my clinic, parents of all sorts, kind of surprised after birth, saying, hey, like, you would not believe, my neighbor that I've never really talked to outside of watering trees together really stepped up for us during this time. So help comes in lots of different ways, and just keep asking for it because you're going to need it.
Thanks for that, Dr. Domanski. This next question that's come through, it's an interesting one, in the sense that, so the question is, addition to the self-care tips, what are self-care tips for your partners? I particularly find this one interesting because although it was myself with kidney disease and myself with transplant, it was ultimately my wife who had to go through the journey. We went through IVF, and she was the one receiving the needles, and she's the one that was pregnant, all that stuff. But in terms of like your partners, would you suggest any tips, or did you find things that were useful for your partners to one, be there alongside you, championing you, making sure you had everything you needed, but also making sure that they were taking care of themselves? Who wants to join in on that question?
I think open communication. I don't know why I keep on using that word throughout this webinar, but it's so true. Like asking them, like taking a moment, like, are you okay? Like, I know I mentioned to my husband that I was doing that. He's like, well, I think I should be attending. I know more about this than you do, right? And I think it's true. I think they are just as invested as we are, and I think they need to sometimes take that break, and we need to check in with them. In terms of tips, I think it's just communication with them, like make sure they're doing okay.
Thanks for that, Nada. Wendy, again, you don't have to answer any questions that you
I
don't
think
want.
I think Nada has it covered.
Yeah.
She had it covered, yeah. Just checking in with them just to ensure that they're okay, and to make sure that you communicate your needs to them so that they can, assist you in any way.
Yeah, I will reiterate that as well, that open communication piece. I mean, for both of us, regardless of the pathway that we went through, we were in it on as a team, open conversations every step of the way, trying to be informed as much as possible of what that next step was. And I found that myself, both of us found it very, very, very beneficial. This is an excellent question. I really love this question. If you could go back and tell your past something, if you give your past self something, what would it be?
Wendy, do you want to go first, or?
Yes.
I think I had a feeling.
If you feel ill in any way and you feel like out of the sorts, get checked out. Back in 2014, when I had the flu, I was at home sick for like 2-3 days from work and school, and I felt fine when I was home, but the minute I stepped out, I could feel my breathing change and I was gasping for air. And I always had a rule that, okay, if you're sick for more than 2 weeks, go to the hospital and get checked out. Didn't follow my own rule, and I waited about 3 weeks before I actually got checked out. And that resulted in me being in the hospital for about 3 weeks. And then that also resulted in me ending up on PD dialysis a lot sooner than expected. So, if you're not feeling well, just like we're entering into the winter season now, if you get a little sniffle and you know you're not feeling well, if you have, you know, kidney disease or any other disease, just if you don't feel well, get it checked out. That's the one thing I will always tell myself. Yeah.
Excellent advice. Nada?
I think absolutely. I think being your advocate is very important. You know yourself, and if you have a rule, follow it, Wendy, not not extend it. Um, I'm going to take another spin at it, and I think I sort of talked about it when I was giving my introduction. I truly believe that I felt very alone in my kidney journey. I think I wish I knew these. I wish I knew what the Kidney Foundation had to offer. I wish I knew there was people like Dr. Demensky, Dr. Haldanowicz. I wish I knew this before. In hindsight, why didn't I mean, I'm not telling anyone to do not Google anything is one thing. I think you need to go seek actual medical help. Google is only going to freak you out more. But I wish I would have taken that step earlier to sort of get and not just follow what my doctor said and said you can't get pregnant, but also that there is a light at the end of the tunnel. There's a solution to all of this, right? Like I had a kidney problem. I quite enjoyed dialysis, and I think people think I'm crazy, but I made that my life. I think I've had multiple people that I was in touch with at dialysis, and they called me after I got my transplant last year, and they said, "I only have one question for you. Why were you so happy on dialysis?" And I was like, I don't know. I just made it my life. I was working full time. I was holding meetings. My staff knew that I was in a hospital bed. I wasn't there in an emergency. They knew I was on dialysis. Like again, it's the open communication, but just knowing that, don't let things hold you back. Like, talk to your doctor. If you like traveling, talk to them. You can travel. Trust me, I've done it. I've been there. There's life has a lot to offer, and just enjoy it, and don't let something like this hold you back. Of course, always seek medical advice. Please, 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 cannot stress that enough. Everyone's story is different. My story is different. I'm just telling things from my perspective. But just know that don't think this is the end of the world is what I'm sort of coming at.
Beautiful message, Nada, and it just really sound advice. Talk to your doctors and stay away from Dr. Google. I could not agree more on those two pieces. Dr. Google is not good for anybody's mental health. Another question coming in here for Wendy and Nada. How's your kidney health now, post having children?
So I had Anaya when I was in 2018. I got as I said, I enjoyed dialysis so much. I figured that this was my life and I just wanted to stay at it until one day my doctor walks in. She's like, "What are you still doing here?" Right? I just wanted to avoid it. I then came into this position where I didn't want to go under general anesthesia. She hears this, she's probably going to laugh because she doesn't know this. But I was afraid of going, I was afraid of getting general anesthesia because I didn't know if I was going to wake up. And I was thinking, what's going to happen to my daughter? I wasn't really focusing on my kidney problem because I was like, oh, it's fine. Like I'm on dialysis now. I'm absolutely fine. But going back to your question, Manuel, which I sort of forgot. Can you just repeat it for a second?
How's your kidney health now?
So since the transplant, I mean, I'm good. Like it's been a year, and I have so much more energy. The doctors always said you won't realize how tired you were while you're on dialysis until you get your transplant, and you're gonna be like, whoa, there's just this wave of energy. When I was on dialysis, I do work, and my husband's like, you need to stop now because you're gonna get nauseous. You're overworking. You need to stop, sit down, and relax. And I'd be like, no, no, no. And then, of course he was right, and never wanted to admit he was right, but he was. Now I can do 10, like maybe 5 times more than that. 10 would be an exaggeration, and I won't get tired. I won't get nauseous. So definitely my health has improved, but then I also had my transplant a year ago. I just celebrated my anniversary 4 days ago. So, but I mean, you're our guru here, Manuel. You've been you've had it for 16 years, so we look up to you.
Been a while. You'll get there. Wendy?
My kidney health is pretty amazing. Just like Nada said, after I got my, when she got her transplant, she had a ball of energy. I was the same way. After the first 3 months, I was jumping off the walls. I just went back to work 3 months ago, and juggling work and kids, it's a lot of work. It's a lot of work. and my body is showing that, you know, I'm tired a lot of times, but I still push through. And so yeah, it's a lot of work, but you have to push through or else you're gonna crash. But yeah. And I've joined a lot of groups in terms of being a mentor and facilitating a group. And Dr. Demensky, I believe you might know our group, the reproductive care and chronic kidney disease support group that I run once a month with Michelle. Anybody's welcome to join, but it circles around to ladies that, and men also, Manuel, that are trying to have a baby and need a little extra support, and we're there to help them. So that's what I'm part of now, and it's amazing. So that's part of one of the things that I do every month on top of work and the kids. So, but I love it.
Excellent. Thanks so much for that response, Wendy. I'm going to quickly pass it over to Sadia, but Dr. Domansky, Wendy, Nada, thank you so much for this conversation. I'm very glad it's being recorded, so it'll be online. But Sadia, I'll pass it off to you so you can wrap things up. I know we can keep going, but Sadia, over to you.
Awesome. Thank you all to all our wonderful panelists for this very informative and very inspiring session. You all are amazing in your all unique, inspirational ways. The Kidney Foundation is committed to providing information and educational resources about kidneys and kidney disease. Through our regional branch offices, we offer advice and support about accessing services within the healthcare system and support in your community. We invite you to contact us if you have further questions. We also encourage those that are interested in joining the different types of virtual peer support group meetings offered to visit our website at kidney.ca. and view the calendar located under support and engagement groups to find a group dates, times that work best for you, including the specialty group on reproductive care and chronic kidney disease. This is a great way to connect with your peers once a month to talk about the challenges and victories with living with chronic kidney disease. Knowing that you are not alone can have a positive impact emotionally, mentally, and physically. When today's webinar ends, your computer will open to a new page requesting that you complete our webinar satisfactionary survey. Your feedback is very important to us and will help us to continue to improve our webinar series. We would appreciate it if you would take a moment to complete it. The survey is available in both English and French through a language button in the upper right corner of your screen. On behalf of the Kidney Foundation of Canada, thank you for attending today's webinar, Family Planning, Tools, Success Stories, and Coping Strategies. Have a great, wonderful day, and thank you again to our awesome panelists.